My name's Joanne McCormack. You'll see most of you, not all of you, because I've actually run out of the cards. Most of you will see my little business card, especially people on the left-hand side of the room. This is just what I give to my patients. It's got some random but good websites on the back. Random in the sense that there are multiple good websites through the world, and I chose them because I particularly liked them at the moment in time in which I got the cards. And I'd encourage you, all of you, to think about doing this. It's something to take away and give people information. It's a very small piece of information they can put in their purse with their credit card and so on. You'll also see some eat and don't eat cards, which I'll talk about later. So just looking at this, my name's Joanne McCormack. I'm a GP from Cheshire, as I've said before. Talking about dads. My dad would have been 90 today, and he died 10 years ago. He was ill for 12 years before he died. And he was a very fit man. He got a lot of physical exercise, but he ate an awful lot of carbohydrate, of the made-at-home variety. People often think about Jeff talking earlier about going to McDonald's or eating fast food. My father ate an awful lot of real food, but it was real in the sense that my mother made it, or he made it into bread and cakes and biscuits, and he loved that sort of thing. And as a child, I was an overweight child. I was a very unhealthy child until I was about 15. And I really feel for children who are overweight. I wasn't so overweight that people would stop and look at me in the street like these guys, but I was chubby, I was much fatter than my peers, and I couldn't understand it. And I thought I'd never find an answer, but I knew that there was some reason why some children were overweight and some children weren't. And so if you look at these three photographs, I think classically people would think that the children on the right are unhealthy and the children on the left are healthy, but it isn't actually the case. All the children up here are unhealthy. Would anybody like to guess what's wrong with the children on the left? Say again? Diabetes. No, they've actually got dental decay, a lot of dental decay. And they live in a very remote part of Peru. And the girl in the middle is my daughter, and she and 15 dental students went to treat their teeth. They live in an orphanage in the middle of Peru in a mountainside, hours away from the nearest village. I'd like to think about who's responsible. Throughout my talk, think about who's responsible for it, and what you can do personally to make a difference to children in our country. We all know the problems with nutritional harm, dental decay, metabolic problems. I don't need to go through them all, but I'd like to. Rongan used this picture briefly. I don't know if you recognize it. Rongan used this picture. And what I notice with very obese children is something I call lack of sparkle. And I see it with very emaciated children as well. And I do have emaciated children in my practice too. And that's the sort of lack of sparkle you get if somebody has a serious head injury and they never quite recover. But when if these children get slim and become slim adults, they regain their sparkle. Within the course of a few weeks or months, these children, as they lose weight, David's nodding there, they get their sparkle back. So 2013 was the year that my professional life changed. I'd like to give you the context. So I was a GP. I became a GP in 1989 as a trainee, and I worked in the same practice for 23 years. And there's something about GPs, they are really inundated with work. And also, nobody's got any sympathy for them, really. They just think, well, they earn a lot of money, they chose to be GPs, so what? But if I tell you that one year I counted 400 targets that we had. Now, I'm not saying that so you'd feel sorry for GPs, but I'm just saying that they've got information overload, and they're paid according to their targets, and they've got no time to listen, and they're not receptive because they've actually got so many targets. They haven't got as many now, but they've probably still got more than, David, you could tell me more, but I gave up counting them. I only counted them once.
I ignore them now.
Yeah.
But yes, you're right, there's still hundreds of them.
Yeah, there are so many. But GPs, they're really... They're receptive for change because their lives aren't very nice. And my life wasn't very nice professionally. And I heard Dr. Robert Lustig on the radio when I was doing my home visits. And he said about the harm that sugar did to children. And he said about how children in the US are getting fatty liver syndrome because they're having too much orange juice to drink, because the orange juice is free, and little children, poor children get free orange juice and free other food, and this free food is giving them fatty liver, and some of them are having liver transplants as teenagers. And I was so horrified about that was the pivotal point in my professional life where I actually resolved to do something about it. And following that, I read, and I read, and I read, and I went on social media as well, and I connected with people, and I found out about Malcolm Kendrick and the Great Cholesterol Con, and I read the book, and I was actually astounded that we had been conned. And when I got to the end of it, I realized we had been conned. And I realized as well that I'd been reluctant to read the book because I thought that there was some sort of heresy about it, or I don't know what I thought, but when I read it, I thought it just made so much sense. And also, there's something, who's heard of the Erbringer diet? One person, and it's also called the London ankylosing spondylitis diet. Now, if any of you have got a friend, colleague, a family member who's got ankylosing spondylitis, go home and tell them, or ring them up or email them and tell them about the London ankylosing spondylitis diet. It can completely transform people's lives. It's not easy to do, but as an alternative, you can take lots of drugs, including one called Humira, that cost the NHS £9,000 a year. And I'm not saying save the NHS money and do a difficult diet, but a lot of people prefer to have the choice and do a way of eating instead. And the London AS diet is founded on, the principle behind it is you have a low starch diet, a fairly low sugar diet, and it kills off the Klebsiella bacteria, which are bacteria in your microbiome that cause an immunological problem. And my sister has been doing this for 2 years now and is really well for as long as she does it. And one of my patients has been doing the London Erbringer diet for 8 years, and she's featured on my website. Okay, so in between 2013 and 2016, I actually have thought, what can I do to make a difference in our country? What can I do to communicate with people? And I want you all to be ambassadors for this. I want you all to think about the information that I'm giving out, that we're all giving out today, and think about how you take this forward. I just sat down with a piece of paper, and I did it many times over several months, thinking, what can I do to make a difference? And so, although I didn't have a website, I set up a website a year ago. I set up another one, so I've got 2 websites now, a few months ago. I started working for a company called iQuitSugar.com for nothing. I don't get paid for it because sugar is a public health issue. And I work on their forums, and I talk to their patients, and it's an 8-week withdrawal program. The focus in all of this is about safeguarding children and on nutrient-dense food. This week I interviewed for 3 chefs. We're going to have a chef in charge of 70 primary schools in Warrington, and I want them to promote nutrient-dense food with the child population of Warrington. It's not perfect, and they're still a bit wedded to the Eat Well plate, but I think we're going to get somewhere. Oh, and the other thing is, if any of you have work meetings or educational meetings through the health service, demand real food. It's amazing how revolutionary that seems. I would go to the course organizer and say, I'm hungry. I can't eat any of this. It's rubbish. I don't want food like this. It's just ridiculous. What about people who need gluten-free? What about people who need dairy-free? Why aren't you providing a variety? And anyway, this isn't going to keep us going. We're all going to be asleep this afternoon. So and they'd say, oh, it's nothing to do with me. They'd say, oh, I don't organize the food. And I say, well, who does? Because I want to speak to them. And they'll say, okay, well, there's the person in charge of the food. I said, okay, I'll speak to them. And the first time I did this, they said, oh, we've got some real food up in the fridge. I said, well, bring it down. That'll be fantastic. What have you got? I said, well, we've got cooked ham, and we've got cooked chicken, and we've got some salad, and we've got some fruit. Fantastic. And so after that, I insist, all my meetings, I insist on real food, and if they don't bring it along. So that's something all of you can take forward. In any place you go to, you can say, where's your real food? And I'll come into a minute, what is real food? Okay, so this is the size of the UK problem. So I'm a safeguarding children's doctor. I deal with process management. I don't examine children for safeguarding problems. So if there's a safeguarding management problem, and I would say there is in this country as a whole, our children are not safe. they've got a lot of dental decay, they've got a lot of obesity, they've got a lot of overweight. And you think 1/5 of 4-year-olds, 4 to 5-year-olds, 1/5 of 4 to 5-year-olds are overweight, 1 in 3 11-year-olds are overweight or obese. That's a massive number. It dwarfs the number of children who are being physically abused, being sexually abused, and you might say that's worse, but if you're dying of liver failure as a teenager, that is, I don't know what's worse. And 58% of 12-year-old children reported that problems with their teeth affected daily life in the last 3 months. Well, we know that dental health is associated with cardiac health, so there's something really wrong here. So this is the question, why do we give our children these? I'm using David's, thank you David, I'm using your slide just in a little, and I do think reinforcement's important because that was a very good slide that David showed us. So actually what I'm going to do is laminate this and show it to patients because they often say, oh, I don't eat sugar, I don't buy sugar. But you'll see that if you give your child Cocoa Pops, that's 24.4 spoonfuls of sugar in the morning. And you'll see if you give your child raisins, which you think of as being quite healthy, that it would be 17.1 teaspoons for 100 grams of raisins. And our standard thing, and I'm ashamed to admit I did this myself for quite a while, was my children had cereal and or toast for breakfast. This is years ago. My children are now in their 20s. And they had a sandwich plus probably fruit for lunch. And they had maybe pasta for tea, maybe with spaghetti bolognese, or maybe they had some chicken and vegetables and potatoes, but they had quite a lot of carbohydrates. And when you do this, sometimes your children become slim, sometimes it makes no difference, and sometimes they become overweight because they've all got different insulin resistance. That's the thing. Oh, and government figures say that we give our children between the ages of 4 and 10, 22 kilograms of sugar a year. Do any of you want to say, look, why do we feed our children in this way? Because it's actually, I've asked lots and lots of parents now, why do you give your children toast and cereal for breakfast? Why do you give them, sandwiches for lunch? Anybody like to speak up? Yeah.
It's convenient and it's low fat, which is obviously the dogma from the last 30
Yeah, convenient and low fat.
They eat it.
They eat it, yeah.
We're told it's healthy.
Easy, yeah, we're told it's cheap, yeah, absolutely. And often people say we haven't got enough time. Well, I raced my husband one day. He was having a cereal and some milk, and I was having a scrambled egg. And it took me 1 minute to make a scrambled egg in a non-stick pan, which I had with some salad from the night before. So it's not that difficult. And my niece Claire, she has 3 little boys whose behavior was appalling. She was always sending me texts saying they've just kicked the teacher, or they keep spitting, or whatever. And I'd say, what do you feed your children, Claire? And she said, oh, well, Adam's just had a chocolate bar, but I don't give it to him very often. This was at 10 o'clock in the morning. It's just mad. I said, Claire, feed your children real food. They will thank you for it, and you will feel better. And we think children won't eat real food, but actually, eggs and bacon are quite tasty. Now, this is something I saw on Twitter, a picture of Coca-Cola being poured into a plant. Now, we wouldn't do that to our plants, nor would we put diesel in our petrol cars, usually. And we wouldn't feed our pets with pizza, would we? So there's something about changing the conversation in the country as a whole and giving, if children come round, don't give them kiddie food, which is brown, give them real food. And if you're going to a child's house, as a guest, give them something, maybe give them something that's not to eat. Give them a book or some cinema tickets or something else, not sort of sweets. Okay, and one of the things I thought, well, is this why we give our children, up to a point I think it's true that, we are told to have low-fat food, and we're told to base our meals on starchy carbohydrates. That's a big thing, isn't it, with giving children cereal and giving them sandwiches. But I think the problem is it's become a truth. It's become a religion. And people defend it like Alison Tedstone. It's a religion. And actually people should say, and I don't want what we're saying to become something fixed in time. This is something that we want to give people ideas. We want the conversations to start. We want people to try different things if this hasn't worked for them. Because this doesn't work for me. If I eat like this, I put on weight. If I eat like this, I put on about maybe 7 pounds in a week. I put on a lot of weight. Some of that's fluid, it won't all be fat, but I put on a lot of weight. And if I ate like this, I would be obese. 5 minutes. Okay. Oh yes, how many of you have skim milk or semi-skim milk in your fridges? Put your hands in the air. Okay, so we've got about 6 people who probably don't believe in skim milk who do it still. Okay, so I think we're feeding our children 5 major fixes a day of carbohydrate, and they're becoming carb addicts. Disagree with me if you like. Okay, this is Claire and her daughter Layla. Claire came in and said, my body's really strange, she said. Do you know, doctor, I get fat on healthy food, and so does my daughter Layla, but everybody else in the family eats the same, and they're slim. I said, you are carbohydrate intolerant, or rather, she told me she was carbohydrate intolerant, and I said, yes, you're carbohydrate intolerant, don't eat potatoes, pasta, bread, or whatever. And she actually gets slim when she does that. She does that frequently. She'll do it for months on end, and then because it's healthy, when she's pregnant, she eats the Eat Well plate. So it's crazy. I said, don't do it. Just get used to it. Get used to have low carb all the time. She loves it, and she's a lovely person, and she's really lucky because she's got no food issues. She doesn't have an emotional relationship with food. How many of you have an emotional relationship with food? Yep, maybe third quarter, yep, and that's a problem. Oh, I missed him. Oh, yes, so this is Oliver, who's 11. He's got non-alcohol fatty liver syndrome. According to Robert Lustig, 30% of obese children have non-alcohol fatty liver syndrome. It's a big problem. And you cannot outrun a bad diet, as Dr. Malhotra will tell us. Not every malnourished child gets fat. This is Tom. It's not a real picture of him, but he also has lost his sparkle. Just look at his eyes. So that's what Tom looked like. He'd lost his sparkle. He had no energy. He was very, very lethargic. And Tom's family are normal weight. He's got the misfortune to eat all his meals at school, all 3. So he eats food, real food at the weekends. And the problem is that you probably don't know, after school clubs and before school clubs don't even have to comply with the Eat Well plate. The strategy for all 3 of those children was to feed them real food. Obesity is a protective mechanism we don't all possess. We can give children incorrect nutrients, non-nutrients. Some of them get fat, some of them stay slim. And trying to stay slim or become slim is probably the wrong way to look at it. I think we should go for having good nutrition, having enough nutrients, learning about it, informing ourselves. Okay, these are all the things I've got to think about when I'm looking at a child who's overweight, but I'm going to focus on hormones. Okay, we know hormones cause our weight to go up and weight to go down. There are lots of important hormones there, but I'm running out of time. I've only got 2 minutes. But let's think about insulin. When I look at an obese child, I don't think he's greedy. I don't think he doesn't get enough exercise, although he probably doesn't get much because he's very overweight. He can't run around very much. But I think that child has insulin resistance. That child needs to eat less carbohydrate foods. And the first strategy with all my patients is eat real food. You can see on your desks about these red and green cards. Zoe and Andy Harcombe helped me, thank you so much, helped me develop them for my practice, because in my practice there are lots of people, adults even, with a reading age of 8. And we wanted something very simple. Let me see. So I advise the whole family to do this sort of thing, and in particular to avoid false food. And false food would be things like grains, sugar, seed oils, sweeteners, any sort of diet foods, and any foods with lists of ingredients. This is it up close. And these are other strategies. Anybody aware of the Brazil dietary guidelines? Yeah. Okay, well worth looking up. They say things like natural, minimally processed foods, learn to cook and plan your meals, eat together with friends and family, and eat out in places that serve freshly made meals. I also use a degree of mindfulness for people who are having trouble, like even mindfulness to children, children who are stressed, because there's a big link between stress and obesity in children. And I talk to families about doing other things other than food treats. Instead of going out for a meal, going out for a walk, going to the park, that sort of thing. And also about non-food gifts. There's a little boy this week who's been coming to see me. He was 50 kilograms at 5. He's lost, how much has he lost? I think he's lost 7 kilograms or something like that. He's lost a lot of weight. Anyway, he's going to get a DS. He's not going to get food as a prize. And this is what happens if you don't solve it as a child. So this is an older man, but at 17, he weighed 24 stone 9. He's very famous. Who knows him? Who's seen him on the internet? Not many. He's called Jeff Sear. He's the best guide to the ketogenic diet from a personal point of view I've ever seen. And so Jeff he got a bad back. He had lots of back operations. He also became a very serious type 2 diabetic and was on large doses of insulin. You can see his hemoglobin A1C is 108. I don't know if I've ever known anybody have a hemoglobin A1C of 108. But luckily, Jeff was very clever, and he read, and he solved it. Jeff worked it out for himself. His doctor didn't tell him. He went on the ketogenic diet, and this is several years ago now. He's stayed slim, and he no longer has diabetes. He actually had an autoimmune liver disease before, and he's been cured from a biochemical point of view and scan point of view. So we've done the ketogenic diet. I'm not going to do it again. These are some real food websites, and I'd like to ask Sam to pass on all the slides to everybody who's here today. And this is, what can you do to help? Okay, so each and every one of you think, would you like to join us? How will you live and share the real food life? Get the conversations going. Use social media. I was looking at Rongan did a tweet yesterday that was reached 128,000 people. And I think diabetes.co.uk, Dr. Panesar reaches even more. He reaches millions. And even on a personal basis, I'm just an unknown GP from the north of England, and one of my tweets occasionally will reach 9,000 people, whereas I'll see at the most 30 people in a day. And so this is me. These are my 2 websites. I'm on Facebook, Pinterest, and Instagram as well. And just ask me any questions.